PA Federationists. Welcome to another episode of White Canes Connect, presented by the National Federation of the Blind of Pennsylvania. My name is David Goldstein. I am the first vice president of the affiliate, and today we're going to take another look back at the 2024 NFBFPA State Convention in Erie. We have Andy Burstein from Accessible Pharmacy Services for the Blind. He's going to tell us where they've been, where they're going, high-tech, low-tech, sci-fi tech. And if you want to learn more about Accessible Pharmacy Services, check them out on the web at accessiblepharmacy.com. Now let's hear from Andy.
It's great to be here in Erie. I come from the land of West Philadelphia, and I bring you all good vibes and love. And thanks so much for including us. This is a great program. I'm really excited to be here. I have 15 minutes. So I'm going to squeeze about 10 hours worth of stuff into 15 minutes. For those of you who are not familiar with us, we are Accessible Pharmacy Services. We're a mail order pharmacy service and healthcare company. We specialize in patients with disabilities. We're the only provider of its kind in the world. We're the largest Blind-owned healthcare company in America, and we're headquartered in Philly. So that being said, for those of you who are familiar with us, we're going through a growth expansion model right now. We sort of outgrew our operations. So it's been a little stressful, but also very exciting. By the beginning of next year, we'll be in full stride. We'll be in all 50 states with expanded hours, expanded services, additional classes and educational programs. We're developing a home diagnostic program at Be My Eyes, where you can actually, similar to like a home COVID test, you can do kidney testing, drug testing, blood testing, and connect to us through Be My Eyes, where we can help you do these tests in your home. So coming soon. That being said, now I have 12 minutes. We're going to talk about ultra low tech, high tech, and sci-fi tech, and how it relates to healthcare. Start with like the ultra low tech. So these are devices. This specific device you can get at any drugstore. You can get on Amazon. You can get at Walmart. They're readily available. This technology out a half a century old. And this one happens to be a talking blood pressure cuff. So I'll demonstrate it. It's a regular blood pressure cuff. And I'm going to put it on and I'm not going to let you hear my blood pressure, but I'll give you the prelude to my blood pressure. I don't want anyone to judge me. So I put it on my arm. I push the button.
Stay seated and refrain from talking during measurement and keep cuffed at the heart level.
All right. And now it's taking my blood pressure. So this is technology. It used to be in like toys. I'm 55. When we were kids, I'm 55. When I was a kid, there were toys that had speaking components to it. It's a very inexpensive microphone. It connects to the diagnostic element of the blood pressure cuff, and it can read your blood pressure out loud. Simple technology, inexpensive. These are like under $20. All right. Now we're going to skip to, I guess, that was like mini low tech. This is low tech. Talking medication labels. So there's a lot of technologies out there. This one I'm going to demonstrate uses an RFID label. RFID stands for radio frequency identification. It's about a 30-year-old technology. It's essentially a sticker with a microchip embedded in it. And what we're able to do is upload medication information to the microchip. And if using a free app on your phone, which is basically an RFID reader, if your accessibility features are on, it sounds like this.
Patient, Jane Washington, medication, furosemide 40 milligrams. Instructions, take 1 tablet by mouth daily. Quantity, 30. Fill date, February 6th.
So you get the gist of it. So it's pretty cool. That can be put on lots of different kinds of packages. There's lots of different solutions like this. This happens to be one. There are hundreds out there. There's also next generation QR codes emerging in the marketplace. Unilever is now integrating it into all their consumer products. So, just be mindful of, like, as you're choosing products, you can actually get a Unilever, food or some condiment, or cosmetic, scan it with your phone and know meticulous details. And there's no cost to you. There's no cost to the retailer. It's just going to be integrated into all the Unilever products. And Unilever being one of the biggest multinational companies in this space that hopefully will proliferate to other consumer products. The next thing I'm just going to talk about. So, for those of you who were in the diabetes group yesterday, we spoke about this. Stacy shared some really interesting insight. And the continuous glucose monitors, CGMs. What is a CGM? Traditionally, and this is newish tech, this is like 10 years old. Traditionally, if you want to check your blood sugars back in the day, you would have to prick your finger, okay, identify that there's enough blood coming out of your finger, put it on a little tiny strip, insert that strip into a glucometer, and get a reading. And I don't have to itemize for everyone here, like all the challenges related to each of those steps. Continuous glucose monitors, it's an absolute game changer. It's a little patch. By the way, I'm giving a lay explanation here. A little patch. It resembles like a nicotine patch. It can be put on different parts of your body, and it has a little pin in it that barely punctures your epidermis. And it reads plasma. And it's able to send that signal to a smartphone, which at that point can be read out loud. And so now all of a sudden, if you're monitoring your glucose, you don't have to go through that whole exercise. You can get your blood sugar readings on demand before you go to eat, before you go to bed, when you wake up in the morning, et cetera, et cetera. There's also, and I shared this story yesterday, this is a story that connected a bunch of dots for me. I'm on the board of directors of the American Diabetes Association Mid-Atlantic region. We run a summer camp for kids with diabetes. Last summer, we had 222 kids. And so everyone from the board did a site visit to the camp. We spent a day there. And it's amazing. Every single kid there had a CGM, a continuous glucose monitor. And what was cool about it was there a few things. One of the features within this, it's a sharing element. So every kid had this monitor on. They were able to share it with their parents. So the parents could have the peace of mind knowing that the kids were safe at camp. And there was also, they took over like this, it's like an auditorium, and they had television monitors all around the room and a collection of nurse practitioners that were monitoring every single kid there in real time. Right. And for me, like, I was like, wow, all of a sudden I was like, wow, the ability to not only have an accessible diagnostic tool that reduces stress, that increases the likelihood of greater health, that can connect you to healthcare providers and to family members. It's pretty incredible. And as a segue there, I don't know how many of you are familiar with it. There's some legislation that's going on right now. And the NFB is actually leading the way in making this legislation come to fruition. It's called the Medical Device Non-Visual Accessibility Act. It's a mouthful, right? But that's what it is. I wish they'd come up with an acronym. It would have been a little bit easier, but that's what it is. And it essentially is just like the CGM. It's going to require all home healthcare devices to have a corresponding app. This is a loose explanation. To have a corresponding app and have that app be accessible. And so, by the way, all the technology exists, but it's going to be required. And all of a sudden, every home diagnostic equipment or treatment equipment is going to be accessible. So what do I mean by that? That could be something as simple as a thermometer to take your temperature. It could be a scale to weigh yourself. It could be a CGM. And then you could do like treatment things like home dialysis equipment or home CPAP machines. Okay. And then the punchline to all of this, and this is the hi-fi tech stuff, the sci-fi tech stuff, artificial intelligence. And obviously, a lot of people have been speaking about artificial intelligence. I still have no idea how it works. But what I try to do is every day, spend 5 minutes every day playing with some artificial intelligence or reading about artificial intelligence. The volume of information, the volume of solutions that are free are readily available. And all of this is going to converge like within the next few years. And what's amazing is that to be living in a time when we can actually monitor our healthcare and manage our healthcare in an accessible way that increases the likelihood of living a healthier life. It's happening right now. So I encourage you all to embrace it. Thank you again for including me today. I hope everyone enjoys the rest of the day. I'm excited to listen to Tracy. Lynn, you're awesome. Thank you. I wish you all well. Thanks again.
Thanks again to Andy from Accessible Pharmacy Services for the Blind for making that drive from the land of West Philadelphia over there to Erie, and that is not a short drive. Thanks again to Andy and Alex and the whole team at Accessible Pharmacy Services for being such a great friend to the NFBFPA. And again, check them out on the web at accessiblepharmacy.com. Save the date, November 13th through the 16th, 2025, we're going to be at the Best Western Premiere in Harrisburg. It is a great venue, so stay tuned for when you can register for the 2025 National Federation of the Blind of Pennsylvania State Convention in Harrisburg. If you are at the convention in Erie, or you've got questions, comments, anything you want to know about the convention or anything else, please let us know. 267-338-4495. You've got up to 3 minutes. Leave your name and town if you do leave a voicemail, or you can shoot us an email at whitecanesconnect@gmail.com. Thank you so much for listening to this episode of White Canes Connect. Take care.